Good afternoon and welcome to this edition of the EuroHeal Men's Health webinar series, where we will be talking about the common urological ailments that we as men suffer and the different options of treatment available. My name is Malik, and I'm your host today, and I have the pleasure of inviting Dr. Datesh Daneshwar to conduct this webinar for today. Dr. Datesh is associated with Prince Medical Center as a consultant and surgeon, and he is one of the most well-known urologists uh, in Malaysia today, with an experience of around 2 decades. He is one of the few surgeons trained trained in robotic surgery in Malaysia. He's also the first urologist in Southeast Asia to adopt the use of Stott's dual shockwave system for treatment of erectile dysfunction. So once we have completed the presentation by Dr. Datesh, we can send a few questions, and which we already have received from our attendees. If you have to ask any questions, you can do so by posting them, and we will definitely take them after this webinar is over. Now, without further ado, I would request Dr. Datesh to start this webinar and also his presentation on today's topic on men's health. Dr. Datesh.
Hi, good afternoon, everyone. Thank you so much for spending your afternoon with me. Hope to share some important information that will help you make better choices for your health. So let's talk a little bit about men's health. Now, a common misconception about men's health is that men's health has got everything to do with sexual function. Well, that is not true. Men's health is a lot more than just sexual function. It involves the management of both psychosocial and physical parameters. That can mean your muscle bulk, your weight, your emotional well-being, anxiety, depression, etc., etc. And one thing's for sure, men are egoistic animals. Being physically able has major implications on a man. So if you are dysfunctional in one of men's most essential functions, it will indirectly cause you to have both mental and emotional consequences, which can be bad for you, your family, and for your future career, etc. Now, before we go further, let me just give you a run through the anatomy, the science behind the organs of interest which make a man. And this in particular will be your urinary bladder, your prostate, your testicles, and your penis. Of course, the bladder is common in females, but females do not have a prostate, testicles, or penis. And these are unique to a man, and they all work in unison to actually give you a better urological well-being, both in your urinary function and also your sexual function. So the bladder, well, it's nothing but a balloon, you can consider it, that holds urine. It functions to store urine, and it also functions to tell your brain when it's time for you to void. It also functions to prevent you from leaking urine, because it's got valves that prevent urine from leaking out. And when you are ready to pee, it actually contracts, and because it's muscular, it's able to push the urine out so that you can empty it. Its position is situated just above the prostate. So if you have any problems with the prostate, the bladder will definitely be affected, directly and indirectly also. Now the prostate, it's a walnut-shaped gland. This is how the prostate looks like, merely the size of a walnut. But as we grow older, it's not uncommon for it to start growing. But not all prostate enlargement causes problems, and prostate enlargement is not a disease per se. You only have a problem when the enlargement causes dysfunction. So what does the prostate do? The prostate is responsible for ejaculation of sperm and prostatic fluid. So the sperm that is made in the testicle never comes out directly from the testicle. It's actually made in the testicle. The sperm will swim up a tube called the vas deferens, finally go and rest in an area called the seminal vesicle, which is behind the prostate. It's like a storage area for the sperm. And when you reach your climax during intimacy, the sperm are pushed into the prostate, mixed with the prostatic fluid, which forms lubrication and protective film around the sperm while it's expelled through your penis into the vagina. Now, the urinary pipe runs in the center of the prostate. So it's something quite understandable that any problem in the prostate, may be enlargement, inflammation, infection, injury, will cause a problem to the urinary tube, and that can cause dysfunctional peeing or voiding. The other important thing about the prostate is I like to tell my patients that the prostate is like the DB box, the main box at home where you have all your fuse points that supply electricity to your house. So all the nerves which are responsible for erectile function come from around the prostate. I mean, years and years of operating on the prostate, one of the key things that the robotic surgery technique has taught us and given us the ability to do is to do surgery, remove your prostate, and yet ensure that you can actually still have erections. And that's because we can preserve those nerves, which are right on the side of the prostate. And these nerves can also get injured, compressed, or become dysfunctional because of a prostatic enlargement or prostatic infection or even prostatic cancer. So sometimes men who have ED do not actually have ED. Understand the difference. ED is a disease. The symptom of ED doesn't mean that you have the disease. So you could have the symptom because of something else. Now, testicles, as I mentioned earlier, they are the sperm factory, yes. That's where all your sperm is produced. They're also responsible for your production of your male hormone called testosterone, right? So those two little testicles are very, very important. And the reason why they're situated where they are, unlike the women who have the ovaries inside, is because the testicles do not like the body temperature. They will become dysfunctional if they were subjected to heat. So that's why they are external. Now, the penis, well, this penis is, as expected, a sexual organ, but it also facilitates urination. So it's got sexual function, it's also got a physiological function to allow you to pee well. So the idea of sharing all this with you is to tell you that all these organs, your bladder, prostate, testicle, penis, all must work harmoniously together. And these are the components that are essential to keep a man feeling well about himself, both physically and mentally. Now, apart from having a good heart, having a good sugar control, being physically fit, having a good endurance, these organs of yours also need to be functioning properly for you to enjoy your men's health in totality. So our problem with men is men are, yes, very egoistic, and you never really want to believe that something could be wrong with you. So you always come up with great excuses of things which are not validated, that you are suffering from something because it's age related. Now, yes, I agree that your hair turns white as you grow older, but lo and behold, there is no science to say that at this age, you should stop peeing normally. Or when you turn 40, it's all right to get up 2 times at night to pee. Or you're 35 now, so it's fine. When you ejaculate, the volume should be less. You're 35 years old, you have 3 children. Why should you ejaculate more? It's okay not to have a morning erection every day. I used to get it when I was in my 20s, but now I'm 40, so it's okay. I'm old. All these are misconceptions. Men are a species which were made, I wouldn't say we were made for procreation, but procreation is an essential function of a human being. So that function is as important as you having a healthy heart, healthy lungs, healthy brain. So ideally, there should not be any expiry on how well it functions unless there's a problem. So if something is wrong, there usually is something wrong. And if you sought early medical advice, most of the time you can prevent it from getting worse, or sometimes even if you're lucky, repair it completely and enjoy the ability to pee like how you did in your early 20s or 30s. Enjoy the intimacy that you could have in your early 20s and 30s also, even though you're 50 or 60. Take home message from this slide is it's not okay to have ED at any age. It is not. Yes, by choice, if you decide that intimacy is something that is not important for you, that's a different story. But you should still be having morning erections every day, because morning erections don't happen because of any sort of, you don't need to be turned on to have a morning erection. The morning erection happens because of a hormonal spike in your testosterone in the early mornings, and that is a physiological thing. So that should happen irrespective whether you have anything to turn you on or there's any sort of excitement. No, it doesn't. It should be something that happens regularly, whether you like it or not. Now, peeing problems. This is something that a lot of men have. One of the most common things is getting up at night. Getting up at night to pee is regarded as an aging process. And well, that's not true. The only thing which definitely happens with age is sometimes you have sleep disorders. And in the elderly people, most of the time they get up to pee at night, not because they have problems in their bladder, it's because they don't sleep well, or they feel cold, or they get woken up by maybe a noisy snoring partner. And when they get up, the first thing they get a sensation of is their bladder, and they decide to go and pee. So getting up to pee at night, well, not normal, and things to look out for, whether you have a sleep problem, are there prostate issues, there could be bladder issues. Ironically, there's also hormonal issues, something called nocturnal polyuria. Now, this is a condition where you have an excess of a hormone which is supposed to be released at a certain time, but now it's released at another time. We have a system in our body which allows us to make 2/3 of our urine output from 7 a.m. to 7 p.m. And after 7 p.m. till 7 a.m., we're only supposed to filter 1/3 of the 24-hour quantity of urination. So that's why we're not supposed to get up to pee. We're supposed to pee before we go to sleep. And then after that, probably not need to pee till we finally wake at whatever time we wake up. That hormone can topsy-turvy, go the other way around, and now you start producing 2/3 of your urine at night rather than the daytime. And that is a medical condition which also can be treated quite well. Now, another thing with pee is peeing too slow. You may notice when you go to a men's toilet, everybody else pees and gets out before you, and you think that's fine. Dribbling at the end is also fine, but no, that's not normal, and that can mean or indicate that you have an issue in your prostate, or it could also mean that you have a weak bladder, which is very unlikely unless you have neurological problems like previous stroke or spine issues, then yes, but otherwise mostly it's a prostate issue. The prostate's probably enlarged or swollen and is blocking the pipe. So now when you try to pee, the bladder can only pump at a certain pressure and it's unable to clear the urination out with ease. Sometimes it's all about the muscles also around the bladder neck and the prostate. So those muscles are supposed to be able to relax when you want to pee and tighten when you want to hold your pee. Those muscles become dysfunctional. And that also can happen because of prostatic inflammation or neurological problems. Dribbling of urine, once again, not normal. If you trickle at the end, always get a few drops of urine in the in your undies at the end of urination, there's something not right. And this has can cause a lot of embarrassment and also make you feel very uncomfortable, especially if you're out and you soil yourself. Having the need to pass motion every time you pee, which is something very common in the elderly people. And they consider it, that's fine, I relax myself and that's why I need to do both things at one time. Once again, it's an indication that most likely you are trying to strain and push very hard to pee, and that's why your anal sphincter also relaxes and you end up also passing motion. All this, in a nutshell, is abnormal. And you don't have to suffer this because so much has evolved in science now that there are so many ways that we can manage this without putting you through the risk of surgery or long-term medications. Now, testosterone, another very important component of a man being a man, is akin to the male elixir. It is the potion that keeps a man functioning like a man. It is not only essential for sexual function, it's also essential for your metabolic function, cognition, your brain, yeah? And also sperm production. So this testosterone keeps a man looking like a man, sexual characteristics, keeps your muscle bulk in play, manages to keep your weight in check, can also help you manage your sugar and your cholesterol health. Low testosterone can also lead to cardiac problems in the future and also to problems in your bone mineral density. So low testosterone, also known as hypogonadism, andropause, male menopause, all these are terms which over the years we've come up with, but you need to know that this is not normal. Men do not have menopause like how women have. Women have this menopause for a very, very clear scientific reason, is because after a certain age, it's not safe for them to bear children. Whereas on men, on the other hand, we don't have any such pressure or stress. Thus, our hormone levels remain pretty much quite stable throughout our lives. Yes, there is a well-known, we recognize decrease in the testosterone as we age. There's no doubt about it. But we know it's not supposed to go down to beyond a certain level. If it goes down beyond a certain level, that is abnormal. And is that at that level, if you remain at that level or above, you should function perfectly fine. Having very high testosterone levels is not necessary for a normal male function. So bottom line is low testosterone exists, and it's something that you should recognize, something that can start as early as your 30s, and it is something abnormal. And irrespective of how you try to change your diet, your lifestyle, sometimes it can be very difficult to boost it up again. So you may need replacement therapy. And replacement therapy is honestly quite safe. But unfortunately, like everything else, there are a few tips and tricks that the physician who starts you on this should know. And these do's or don'ts can be a little sometimes difficult to find a physician who actually understands them completely. Because testosterone is something that may be safe and beneficial, but if you are dealing with somebody who has prostate cancer, it's not something you should be giving. Or if you're dealing with somebody who wants to be fertile, testosterone replacement can be actually bad or can actually decrease the fertility despite increasing the patient's virility. So this knowledge needs to be there in the physician who starts you testosterone, and this discussion needs to be with you why you're replacing testosterone and for what purpose. Now, the other hormone of interest in men is estrogen. Yes, believe it or not, men also have estrogen in the form of estradiol. And this is very important for our sexual function. Eh? Too much of it is not great. Too little of it also is not great. It can cause problems in your bone mineral density also. And it is essential for normal male development. But if you have an excess, which unfortunately nowadays is becoming quite common, one of the reasons is you may have high estrogen is this estrogen is like a steroid, and steroids are nowadays used in a lot of food products that we eat. So if you over consume meats that have been treated with steroids, that can cause a hormonal dysfunction in your body itself. And the other thing is, in Asia, a lot of us like to eat soybean. Soybean has been shown to actually increase your estrogen count, and this can cause both physical and functional dysfunction. Physical in the sense, if you have too high estrogen, you can actually develop a little bit of breast tissue. And physiological function, it can actually cause erectile dysfunction and a decrease in your libido. So now, what is ED? Erectile dysfunction. When you hear that, I think most of you would think that you rather be called a leper, somebody with leprosy. It's a stigma. You got ED. Oh my God, it's bad. But the good news is that most of the time, you don't actually have ED per se. You have the symptom of ED, which is not being able to have hard enough erections, not being able to sustain an erection during intimacy, not being able to ejaculate properly. Most of the time, it's not ED from what you are actually suffering from. It's actually something called sexual dysfunction, of which ED is just one component. So, thankfully, in years of my experience, I've seen that ED is usually just a symptom. You don't actually have ED. The blood vessels in your penis are still pretty much okay. And taking medications or any supplements or any traditional medication, which purely is to just open up the blood vessels in the penis, is not going to help you overcome the problem. It's just overcoming the symptom. And you will have to you'll be dependent on that medication or that supplement forever now. But if you were to find out if there was a cause of that symptom and treat that symptom, you may never need a supplement or a pill to overcome the erectile dysfunction. So once again, I'm going to reiterate the fact that there's no age limit for men to have the ability to have good erections daily, even if it's not for intercourse. If you have now no need to be intimate for whatever reason, and you have decided that intimacy is no longer something that is a part and parcel of your life, having a good erection helps maintain the length and the turgor of the penis. And this is important in your ability to be able to pass urine. The penis is like a pipe. If you suddenly lose the length of the pipe, you may not have much to hold on to, and that can lead to you needing to sit to pee, or sometimes peeing and soiling yourself because the pee just trickles down your thigh, maybe. So one of the important things as men, which you should be responsible to look out for, is the morning wood, the morning erections that you get. This is a scientific fact that having a morning erection has a positive psychological impact on a man's well-being, and it is being recognized as an independent indicator that you are likely to be in good health. Meaning that if you can have a morning erection every day without fail, good hard morning erection, it is likely, almost certainly, that you have no chronic disease like hypertension, high cholesterol, diabetes, and hormonally, you are probably sound. So please use that as an indicator to tell you that, yeah, everything's okay, I'm well. And if you don't see it, don't fret, get somebody to look at it, get somebody to talk to you about it. There may be simple things like not sleeping well, excessive alcohol that may be causing it also. It's possible, but it's not normal not to have it. That's the point. So yes, causes of ED can be hormonal, low testosterone, high estrogen, can be because of blood circulation. Yes, if you have arteriosclerosis, I mean, if you've had a previous heart disease, previous heart attack, you have stents in your heart, there's a good chance that you could be having blood vessel issues in your penis also. we as men have the AAA grade blood vessels in 3 parts of our body. I mean, these are the top quality blood vessels that the human body has. They are situated in the brain, in the heart, and in the penis. The penis being the smallest, the heart being number 2, and the brain being the largest. So the theory goes that if you have had a heart problem, then the chances are, because of a blood vessel problem, of course, the chances are that your smaller blood vessel in your penis is also dysfunctional or narrowed. So that needs to be helped. The other thing is, of course, the other way around. If you are found to have erectile dysfunction, especially if you are below the age of 40, and we find that there's no other cause, no hormonal cause, no prostate issue, etc., then the chances that you are developing a heart disease is also very high. So at that point, a urologist will probably ask you to go and see a cardiologist to get a cardiac assessment before he starts you on any medication for your erectile dysfunction. So that is why if you're below 40 and you are having symptoms of ED, don't sit on it. Chances are it's nothing to do with your heart. Chances are it's not going to do with your blood vessels, but then again, it requires attention. The other thing, of course, which we never must ignore, that erectile dysfunction definitely can be psychological. The brain definitely plays a very big role in intimacy, erectile function, ejaculation, etc., etc. So men are very impressionable creatures. We are visual, how your partner looks, how your partner behaves, stress at work, monetary stress, things like that can have a negative effect, but very little, to be honest, very, very little. I see a very small component of my patients actually who have psychological component solely responsible for ED. It can be part and parcel, but very rarely is it the only reason why a patient is actually suffering from erectile dysfunction. So ED, most of the time we assume it's because of blood circulation problems and we blame blood vessels. This is not true. And the bottom line is taking pills is not the solution to it. It's merely just overcoming a symptom. It's almost like taking Panadol for pneumonia. Pneumonia is a bacterial infection of your lungs which causes fever. You take a Panadol, your fever comes down, you feel better. But what you need is an antibiotic to kill that bacteria in your lung. So unless you take that antibiotic and sort it out, you're not going to cure the problem. So this is the same reason why you need to have your ED looked at and assessed before you decide that you need to be dependent on pills now. So what I've seen in my practice, patients as young as 20 coming with sexual and erectile dysfunction. The most common problems in this age between 20 and 60, they have prostate issues and hormonal imbalance. Very few of them actually have circulatory problems or circulation problems. Most of them are prostate or hormonal. Now, prostatic enlargement. This enlargement is normal. We have sort of a cutoff to tell you, yes, you have a normal size prostate and whether your prostate is enlarged or not. But as I told you, size does not really make a difference unless you're having symptoms. You can have a huge prostate, but if you have no symptoms, you don't have to do anything about it. So the enlargement, yes, can happen, but you definitely don't have to suffer the effect of the enlargement. If you're having effects or symptoms of the prostatic enlargement, that is what is abnormal. Having an enlargement of the prostate is normal. Understand this. But having the symptom associated with an enlargement is not normal. And that should be treated or should be looked at because that will affect your quality of peeing, can affect your sexual function, can affect your ejaculation function. And if you don't watch over it, the chances are it's just going to get worse as you get older. So enlargement may not cause symptoms at all. And if it doesn't, then you don't have to treat it. So if you have a prostate, which is now, let's say 40 grams, it's supposed to be for 20, but you have zero symptoms, you're peeing already, you don't get up at night to pee, you have great erections, etc., etc. That means that you don't need any treatment for it, and you don't go and treat the size. Now, being told on a routine ultrasound that your prostate is enlarged should not worry you. But if you are told that and you have symptoms, what I explained earlier, slow pee, dribbling, getting up at night, then yes, you need to seek proper advice, because those symptoms can be treated. And please, it is not a must that every prostate problem leads to surgery. Remember that. There are so many other options, non-surgical, safe, that won't change your entire course of life, that can actually improve your quality of life, give you better sleep, give you better satisfaction during your sexual function, etc. So not all enlargement of the prostate now is related to the increased number of cells. Now remember this, benign prostatic hyperplasia is a term, BPH, denotes that now you have an increased number of prostatic cells. That's why the prostate is enlarged. That's the theory about prostatic enlargement. More cells, more enlargement. Okay. Now, not all the time does your prostate enlarge because the cells have increased. Sometimes the cells themselves increase in size. This is called edema or swelling, when the cell gets filled with fluid because it's inflamed. And that also, the net result is enlargement of the prostate. And that enlargement can be painful, can be not painful, but can give you exactly the same side effects or problems with peeing, like how you would have with a prostate which has got an increased number of cells. One of the more common things that people with prostatitis or prostate inflammation will have over people who have normal enlargement is sexual dysfunction. Because as I explained to you earlier, the nerves for the erectile function are on the sides of the prostate. So if there's inflammation or if it's hurt, those nerves also go wonky, they also will get paralyzed. So prostatitis, many men have this. I see patients every single day. Every single day I have new patients with prostatitis. And we always thought that it was associated with some form of bacteria or infection or pain, but this is not the case. We know that prostatitis, you can have the painful variety, which is the inflammatory variety, or the non-inflammatory variety, which is the non-painful variety. And this inflammation is in common terms is that the prostate is injured for whatever reason, and it swells. And this injury can be related to a previous urine infection, previous sexually transmitted infection, a previous procedure, urological procedure. Lo and behold, it can be also related to excessive, prolonged sitting. People who like to cycle because of the pressure on the perineum, because that's where you sit on the bicycle seat, that's where your prostate is, the perineum. That pressure itself can also cause your prostate to become inflamed or angry. And these can be a lifelong problem. It can be chronic. You could be living with it for years and years and years without even realizing that you have it. And in the past, treating this used to be a little bit complicated. There was seldom a cure. You could manage it, but it used to come back. That's why we call it chronic. It'll come back every few months or maybe a few years if you're lucky. But nowadays, we have an option where potentially we can cure you from this ailment. So what can prostatitis do? Prostatitis can cause various problems, so many problems. One of the most common is premature ejaculation. Then you have also painful ejaculation. You also can have poor erections. You can have lack of morning erections. You can have low sexual desire and libido. You can also have low self-esteem. These are all problems related to prostatitis. So going through all the symptoms, you get poor erections, low sexual desire and libido, and low self-esteem. So yes, these are things that men will live with over a prolonged period, blaming themselves, blaming their activities, blaming their life choices. But actually it's all got to do with just the prostate becoming inflamed. Now coming to your penis, size does matter. No matter how much we may lie to ourselves to say that size doesn't matter at all, size does matter. And a decrease of size only happens if there's a problem in your hormonal function, or if there's a lack of adequate blood supply to your penis over a prolonged period of time. if the blood circulation, that's where the morning erection is important, because that ensures that the blood vessels in your penis are always open and dilated completely, at least once every day in the morning. And if you don't have that on a regular basis, eventually the blood vessels start shrinking. And this is a process called fibrosis. And you can then develop shortening of your penis. Now, shortening of penis is definitely not interesting when it comes to your sexual function. But as I explained earlier, it can also affect how you pee. And a lot of old men have this. They have very, very short penises because they've not had erectile function for years and years and years. And it becomes almost impossible for them to even hold your penis to pee. And they end up spraying everywhere. So they end up having to sit every time they need to pee. And if they don't find a sitting urinal, then it becomes a whole bad issue. They soil themselves, they wet themselves. It'd be quite embarrassing. So maintaining that erectile length is your responsibility, and you must ensure that you should try to have morning erections, or you should ensure that you're physiologically well enough to have morning erections every single day. Well, that's about all, guys. I think, yeah, that's all I wanted to share today. Thank you very much for joining me on Saturday afternoon to share my thoughts. I'm going to pass this on to my moderator now, and we'll be more than happy to answer any questions that you guys have shared. And you guys can always visit my website, euroheal.com, where you'll be able to even WhatsApp me any burning questions, and send me an email if you want to have a private chat with me regarding something that is bugging you, or something that you need a second opinion maybe. I am more than happy to help you and to guide you in the best I can, of course, limited capacity, but then again, could point you in the right direction.
Okay, thank you, Dr. Datesh, for the explanation. Maybe just a few questions that we have already received earlier. Number one, what are some of the treatments or treatment options available for some of these mental health issues that women may face?
Well, I think all of the men's health issues which I've mentioned can be treated, can be managed. You have, starting with options which include medications, drugs, to surgeries that can help manage this. And unfortunately, medications usually very seldom were to be taken one-off and then the problem gets solved. Most of the time, you'll have to take them over a prolonged period or indefinitely. And surgery, well, surgeries could cure or sort out problems, but they had their own associated complications and risks, which usually would send patients away, and patients would rather not go through those complications and just live with your symptoms. So this was something that we always faced in urology, that people who opted for surgery or for curative options were those who had very severe symptoms. But those who had minor symptoms just learned how to live with it. And they just carried on with their life, suffering from those symptoms, which cumulatively led to bigger complications in the future, psychological and social especially. So nowadays, for things like prostatitis, for erectile dysfunction, we have a curative option called shockwave therapy. This is using sound waves, which we have been using in urology for the last 40 years. We use these shock waves to actually break kidney stones. So the technology is not new. It's been around, it's validated, safe for humans, it's been used in millions of people. But now that same energy has been modified and is used to cause tissue regeneration and also stem cell release in your body, so that if you have a dysfunctional penis or a dysfunctional prostate for that matter, the shock wave can actually naturally allow your body to heal itself. So you won't require any long-term medication, and you get a curative option where your body actually repairs itself. Quite remarkable. And the success rate of this is extremely high. Almost 80 to 85% of patients will actually show some positive response.
Is shockwave therapy safe? Is there any side effects that people might have in mind?
Right. Okay. So good question. So as you can see from just behind me, the machine is here. It's It's a form of therapy which is totally external. It's not internal. It's not invasive. It has got no reported side effect until today, no reported complications whatsoever. There is no downtime per se between treatments or during treatment. And now 3 years, probably over 1,400 patients that I've treated. I must say the success rates are extremely high, and I haven't had even one patient with any type of complication or side effect.
Okay, we have a question from an attendee here. Hi, Dr. Datesh. Is there any kind of food that can increase testosterone and sex desire?
Well, yeah, another great question. I mean, there are certain foods which are considered to be aphrodisiac. For example, garlic. It has got that science behind it, that it's known to have some aphrodisiac quality. But honestly speaking, as long as you keep to a moderate diet, a diet that is not extremely rich in soya, not extremely rich in a lot of meat, you should be able to maintain a good hormonal balance and have a reasonable amount of virility from your food intake. Good fresh vegetables, good fresh food definitely has a role because of the antioxidants that it provides. Maybe taking a simple multivitamin or vitamin E could also be beneficial to a certain extent. But there is no particular food except for food rich in soya, which could have an indirect bad effect on your male hormonal and sexual function. But for that, you have to be consuming a lot of soya. That doesn't mean you don't. I'm telling you not to consume soya. I'm not saying that. But yes, if you do consume soya on a daily basis, you should look at maybe replacing that protein source with something else.
Okay, that's another question offline here. I have been suffering from prostate problem for over 2 years. Can I also undergo shockwave therapy for this?
Yes, so definitely the option is definitely there, but it requires an assessment. As I explained earlier, shockwave therapy works for prostatitis. So you have a prostate enlargement, and if it's because of inflammation, then yes, shockwave therapy works extremely well. But if, let's say, your prostate is enlarged because of prostate cancer or BPH, where you have an increased number of cells of the prostate, then it may not work. But in my experience, most patients definitely have a component of prostatic inflammation. You must understand that the prostate is 70% gland, meaning cells of the prostate, and 30% is muscle, which is coated around the prostate. So that muscle is the one that sometimes becomes very stiff, and that's the one that becomes swollen. So with shockwave therapy, potentially, I can reduce the swelling of that muscle, if not the overall size of your prostatic cells itself, but that muscle can become more supple or softer, so to say, and that could allow you to pee better and feel better. And definitely, if that is the case, even the erectile function will improve.
Now, some may have questions about shockwave therapy. Some may ask whether is this kind of treatment expensive and things like that. So, is this kind of treatment covered by any medical insurance and per se?
Yeah, I mean, the treatment, of course, is definitely not cheap. Nothing great or nothing good comes cheap, that's for sure. But the good news is we are the only center in the country right now where we're offering this quite to all our patients who deserve it. And we have managed to secure to get insurance coverage for this treatment to be done under daycare. So our urology center here is a daycare center. So we get your insurer to cover you for this in most cases, as long as we are treating, of course, prostatitis and prostate issues. And yes, that's why we have a large number of patients who are enjoying the benefits of this treatment right now.
Okay. Do we have any more questions from attendees? No, I don't see any more questions here. I hope everyone watching this has gained some knowledge and information about men's health, what you might not know, and things like that. So if there are no more questions, I guess that is it for today. Thank you very much, Dr. Datesh, for your presentation and talking about men's health issue on this
Thanks, Malik. Thank you so much.
lovely Saturday afternoon. Thanks
Yeah.
everyone for joining this webinar series on men's health by Euroheal. And until we see you again next time, have a good day, everyone.
Cheers, then. Bye.
Bye.